let's welcome up. This is the Church of Root Cause Resolution. We got Dr. Kelly Brogan coming back up. We've got Dr. Lily Rosenthal coming back up. And joining them on the panel, we have Dr. Peter Bongiorno and Dr. Lewis Gross. So, welcome. Grab yourself some mics. Yeah. All right. All right, Kelly, you sort of took us to church a little bit earlier, but you know, we'll go for a double. I'm going to actually start with Peter. Peter, I had no worries having you here on the show because between you and your wife, I think you have a record number of appearances on Dr. Oz. How many between the two of you?
Actually, it's mostly her, and it's 18 now.
18, wow. That's awesome. So look, when I say the words root cause resolution, what is it grabbing your heart?
Yeah, well, the first thing I think of in naturopathic school, going to medical school and out in Seattle, I went to Bastyr, and I remember from day one they started talking to us. I remember they pulled us out of anatomy class, actually. It was our first anatomy lab, and they took us out and they brought us into the auditorium, and the president of the school, who started the school, his name was Joseph Pizzorno, he sat down and he talked to us, and he told us that we're there for a reason, and we're there to figure out what's going on with patients, to really talk to them, to connect with them, to find out the root causes of illness. And I never forgot that. It's very powerful, one of the first days of school, to start with that philosophy. And I've been in practice for about 11 years, and with each patient I see, when I sit down with them, I want to know and I want to think about, well, what is it that's going on with this person that's causing these issues, and what are causing those issues that are causing those issues?
You gave me an awesome example with regard to that in psychiatry or in mental health, and I think that was a really powerful one that you shared. Can you share that earlier?
Sure, and I think Dr. Brogan probably agree as well. You know, I've written a few books on anxiety and on depression now, and one thing that I've learned is, first of all, most of the patients I see come in and they're already on antidepressants. And antidepressants are a tough road because, you know, research shows that at best they work maybe 25 to 30% of the time, at best, which isn't really any greater than placebo, which kind of tells us, you know, they're not really doing their job. And even for people who seem to get some benefit within a short amount of time, within a year to 2 years, they stop working anyway. And one of the issues that I definitely see with that path is that when people get off medications, even if they worked, but they have to stop taking them for some sort of side effect, or they stop working at that point, they go through all the issues and all the emotions that they had that brought them to that prescription to begin with. So it is a bit of a dead end, because if you're not looking at the underlying root causes, if you're not looking at why a person's not sleeping, what they're eating, whether they're exercising, whether they're stressed out and why they're stressed out, and looking at their poop. Poop is so important. If you don't get their digestion right, there's no way you're going to get their neurotransmitters right. And I think that's one of the mistakes. You look at antidepressants, and the problem is that you're going after neurotransmitters, and that at best is a symptom of other underlying issues, because why are they out of balance to begin with? It's not a person's chemistry. There's a lot more going on.
And if you want to learn more about that, Dr. Brogan's talk on the evolution of psychiatry from an earlier functional forum went into the monoamine hypothesis pretty clearly. Dr. Lewis Gross, I want to come to you as a holistic dentist. What are some of the underlying causes, a root cause that you see that are in the mouth that aren't generally, you know, recognized by medicine?
Well, I want to thank you again for having me, and stress that everyone in choosing a dentist should look for a holistic dentist. We're all over the country. Starting with root cause, we could go back to root canal. And I mentioned that, in my opinion, probably 75% of root canals are either unnecessary or the prognosis is so poor because the bacteria already locked into the tooth that the root canal is just a temporary fix. But what it's doing is locking anaerobic bacteria into your body, which will, over the course of your life, drain your immune system, your lymphatic system, of its resources, and trying to fight an infection that it cannot cure. So I would stress you, first of all, to insist that your dentist try to save that tooth. But a lot of it, I think, is about intention. And I was telling you a story earlier. I had a very famous actor in the other day, and I asked him, why did you choose a holistic dentist? And he thought about it for a long time, and then he turned around and said, because of your intentions. And I think really that's a lot of what we do here as holistic doctors and functional medicine, is we come to a patient with a different set of intentions than a traditional doctor would.
That's powerful. Thank you for sharing that. What are some, you know, I know Dr. Brogan talked about, you know, chemical exposure. I know that's a kind of controversy in the physician, in the dental world. What's your take on it in the practice there?
Well, a holistic dentist is also obviously very concerned about environmental issues, and mercury amalgam fillings has been where we started over 30 years ago. Originally, when I started as a dentist, you were not allowed to tell patients that the silver amalgam was 50% made out of mercury. Over time, the ADA has loosened their position. They now admit that the mercury does escape, but their position is that dental mercury is not enough to cause medical illness. But if you look at the holistic patient from their sources of mercury from fish and other places, that mercury has become a big issue. We're also concerned with radiation and basically acidity issues. So we would look at nutrition and see what we can do to alkalinize the patient. We're finding that acidity, every patient that comes into my office, we use litmus paper and test their saliva, and I'm finding significant numbers of young people who don't have decay because they grew up on fluoride, but they have severe erosions of their teeth. And I believe that acidity is a big issue, so we would then offer nutritional counseling.
Awesome. That's really powerful. Okay, well, get your questions ready in here. We've got a couple from Twitter, and then you know, there'll be some opportunity here. So Dr. Megan Walker up in has a question for Dr. Brogan. She says, what do you see as the role of the traditional MD within this new functional paradigm?
Well, I think we have an opportunity to lead the charge powerfully, right? Because I don't say anything that Peter hasn't been saying for a very long time, and naturopaths and holistic practitioners haven't been saying for centuries. I don't really have many new ideas. But the fact that I've come from the conventional fold, that I've seen it from the other side, apparently is a powerful message. So I think having that under your belt and opening your eyes to a different paradigm, you know, fortunately or unfortunately, puts you in a very strong position to lead the charge to change and accelerate the evolution of medicine. James.
Yeah, thank you. Well, one of the things that you said, the very first functional forum that I wanted to ask you about now is just how you feel about your job, like what you do every day and how you feel about that. So, I mean, has that changed in the last year and a half? You seem pretty excited about going to work every day, which I know that, you know, the great work of like Dr. Pamela Weibel looking at physician suicides. I mean, that is a really tough and ugly thing to look at, but we need to look at it. I mean, it's a serious problem. I don't see a lot of doctors enjoying their job.
Right. So when I mentioned that sort of like radiantly healthy, you know, sort of model, the purpose piece, I think, is an indispensable part of health, of what I prize as my current health. And the purpose that I have found in my path, not only in cultivating my own health, but in sharing what I've learned with patients, is unparalleled. I mean, I wake up, I think about it all day, I dream about it when I sleep. You know, it's a total passion project. So it's absolutely almost not an option for the conventional physician to engage their work in that way, because they can't personalize it.
It's a great, you know, it's a great insight. So we're gonna have a few questions in a minute, but there's a new segment that I wanted to introduce to the panel, which is, you know, I know we have a lot of doctors who are watching, you know, online or otherwise, and in the future, that's the beauty of this format, is that this content that you're watching tonight will be available forever and can be used all kinds of different ways. But I know there are also a lot of very experienced holistic doctors that are here and watch as well. So what I'd like to do, and maybe we can start with you, Lily, is, you know, do you have a awesome clinical pearl that you've gathered for 25 years of experience that even the most sophisticated holistic doctors, which I see a number in here, Dr. Hoffman, Dr. Fratellone, there's tons of really experienced great doctors in here. What can you teach them, Lily?
So glad you asked that question, because I've been meaning to get this on a wider platform. The drudgery for us physicians in the audience, the drudgery of doing a history and physical examination was always, you know, this isn't so important, this isn't so exciting, this isn't so sexy. But the root cause of getting to what really helps, we need to sit with the patient, we need to take a very thorough history, and we need to do a very thorough physical examination. That is 99% of the clues. So don't pass that by. Remember that. Remember your own roots of what you learned when you were a medical student, because there's absolutely no substitute. With all the technological advances, this is a very underappreciated dynamic. First of all, the power of listening to the patient. And it is transformative for patient care and also for the future of medicine. So please do your histories and physical examinations.
Awesome. I love that. Peter, you got a tip from your years of experience to the experienced physicians watching?
Yeah, and to add to that, I would say, and I have a lot of students who come and work with me from both conventional medical schools and also from naturopathic schools. And it's very important, one, to connect with the patient. If the patient doesn't feel you're really in their corner and they don't feel that warmth and that compassion, it's hard to create health. The second is to make sure that every recommendation and treatment plan works on sleep, diet, lifestyle, the right nutrients. And then, if there's any kind of special sort of clinical pearls that a person has, like for instance, a couple of years ago, I started learning about mold toxicity. And it was something I thought about, said, maybe this has some benefit. I'm actually starting to find a lot of amazing results with that. Now, it's interesting because if you just work on mold and mold remediation and you're not working on a person's sleep, stress, exercise, diet, if you just focus on that one little thing, I don't think you'll get the whole picture. But, I work with a lot of emotional disorders, and what I find is you have to work on all of those pieces at the same time and then find that special one or two things that maybe other doctors have also missed. And it's about putting it all together.
So when you've identified that mold is an issue, what are some of the things that you're seeing that's working nicely?
Sure. Well, of course, it's removing the obstacle to cure, right? So you have to teach people where to look to get rid of that issue. And then the second thing is you need to work on their body to help clear it out. So there's special ways to detoxify, to really clear out the liver, to help the liver put out bile that'll get rid of this stuff. So, and there's certain ways to do that with different fibers. Things like beetroot can be very, very useful, flax fibers. There are some conventional doctors that also use even certain medications to help that process. I like doing it as naturally as possible.
Cool, awesome. Dr. Brogan, clinical tip for the masses?
Yeah, I think it's probably a pretty simple one. I would say don't make nutrition the window dressing, right? Because I think that when I stopped prescribing, I wasn't sending patients the message any longer that nutrition was sort of like the add-on to the actual treatment, which was the Zoloft or Prozac or Abilify. So now leading with nutrition, I find that I, get yields it shocks me every day. I would never expect, and it's because it's the singular intervention that I emphasize from the first consultation.
Awesome. Dr. Gross, little clinical tip for all people out there from a dentist.
Sure. I like that Peter was talking about sleep because as I graduated as a DDS, a doctor of dental surgery, but now I think it's about dental medicine. The oral microbiome is the beginning of the whole bacterial culture in our bodies. And in sleep medicine, a dentist can be a great part of a team, and sleep is so important, it's undervalued. And I believe that an integrative, holistic approach is going to be the future of that, and dentists should be included in their team.
Awesome. All right, we got some questions. You got a great panel here. It almost sounds like a joke. A psychiatrist, an osteopath, a naturopath, and a holistic dentist walk into a bar. Who wants to have a question here to the panel about anything that you've heard so far? Anyone here in the audience? We got a couple of questions. Coming in. Actually, maybe Lily, I'll come to that. Do you maybe a couple of other examples that you could give of structural issues that end up looking like they need, that have been treated biochemically?
Oh, there's so many. I mean, all pain, I think, is treated biochemically when we're not considering the mechanical contribution. So really, everything in the body. I mean, people come in with neurological problems, and people go right to the MRI. There's got to be a disc, but nobody's considering. When I look at the body, I look at it in 3D because I have that training. So I'm looking at the layers of the anatomy, the actual structure. So when I look at a person, I know it may freak them out when I say this, but I tell them that. I see all the structures inside your body, and I'm looking for what could be the cause. So from headache to nerve problems to back pain to all of this has to depression. You know, all of this, it's all related. There's physical and emotional symptoms which are often related to structure. And by the way, it goes both ways. So you could have a physical problem and then you can have a mental problem on top of it because of the physical problem. So what you were saying before, unless you address lifestyle modifications, you're getting nowhere. You're just going to be a Band-Aid. You're going to be buying into a symptom management system, which absolutely never works. So the concept that self-care is healthcare, you have to educate the patient about what they're doing in their lives that brings them to a point of ill health and injury. And that's a huge consideration.
And how do you empower self-care as healthcare in a structural way? Like for their structure?
I talk about very specifically, I go through the questioning of how they're sitting at their desk. Where is their computer? Are they crunching their phone? What are they doing in their lives that are not structurally supporting their system? And we all do it. We all have postural habit. I'm sitting here with my legs crossed over to the left. I'm creating what we call a fascial strain pattern. If you're a dancer, so I'll do this. Which is what I would recommend to my patients, or even better, cross at the ankles. So we all have habit and things that we do, and if we don't exercise or unwind these structural propensities, we're set up for restriction in the body. There's not optimal flow, and problem is, it's like a river, like a mucky river. It gets dammed up. There's not good flow. It's not healthy. And in the body, we set up the same situation unknowingly, unless you have pain. And then, thank you for listening. Teaching already. And just telling people that this actually matters is huge. So the awareness, the intention and the awareness of, oh, maybe I shouldn't be cradling my cell phone for other reasons besides biomechanical. You shouldn't be doing that. But that's not a good idea. That's a setup for not a good, and I see it all the time. I'll just, one quick story if I may.
Yeah, go for it.
I treat musicians, as I mentioned. I had a bagpipe player who came in and says, I have this shoulder pain right here. Did not even think that it was the pipe of the bagpipe laying on his shoulder hours and hours a day that could have been the cause. To me, it was obvious because I look for these things. So whatever the bagpipes are in your own life, in your own patient's life, think about that. What is it that they're doing in their lives that's creating a setup for restriction in the body, which then impairs function? And you'll believe it, it's much easier than you think. It's actually common sense. You just have to know to think about it.
Awesome. We got some questions popping up here. So let me pass. Here's Jeffrey.
Hello, Jeffrey Rose. I'm a clinical hypnotist and nutritionist. I'd like to ask you if you could speak to the idea, rather than just sitting with good posture, actually standing more often and squatting instead.
Squatting. I know of there's a physio ball you can sit of. I don't know, maybe you can share that with us. I really don't know of that. I've never recommended that to a patient. I do often recommend every 20, not often, always, of getting up, moving, kind of cross-training. Static posture is really not good for the body, but I really don't have information about that, but I'll have to take a look. Feel free.
Yeah, my understanding is that most cultures after being children, with exception of maybe people from India or China, will not squat, and yet it's very good for our lower back. So when you could even sit down, look at your iPhone or so and squat, keep good posture, that actually feels good. Just kind of like laying on your back when you sleep with something underneath your knees.
I'm going to suggest that I'm going to get back to you and report how people are dealing with that. I'm going to try it myself.
Fantastic.
Thank you.
We'll have a squat watch. You know, it's quite interesting. I was doing a little bit of research on the blue zones for my TED talk, which we get to see next month, hopefully. But basically, no one in the blue zones, which are places that live to 100 consistently, no one exercises. Definitely, no one goes to the gym. But what they do is they get up and down. So in Okinawa, Japan, they're going up and down 40 times a day, up and down, and that's the real exercise. And so I think that's an interesting point. Question here at the front.
I'm a mom, and I think a lot of the things that we have developed over time are habits, maybe things that we've watched from our parents, things that get, shown from us from other people. So what can we do as preventative, as parents, to help train our children to walk better, to stand better, to move their body in a way that's optimal rather than getting into these bad habits?
Is that a question for me? Yes? Okay. Well, first of all, habits, we do not inherit bad genes necessarily, but we do inherit bad habits. So I like that you mentioned that. So first of all, being a role model for your kids is super important. I have a 15-year-old daughter myself, and she moves, you know, and moving in general, especially now with all these screens that they're planted at, it's bad news. So being a role model for your kids and moving yourself and changing position, and I'll mention squatting. Kids, I think, do that naturally, which I just learned something or you reminded me of something. And getting air and exercise and moving. Is that what you're asking? If how do we get our kids to move? Is that?
Well, even right movement, aligned movement.
Interesting. I wouldn't worry so much about that because the body is really smart. The body is really intelligent. So I think when we try to restrict it, there are problems. So I think movement, the body will inform you. And I always say this: which people don't get injured so much. People that actually recalibrate on a regular basis. I think kids have a natural way to recalibrate, and they'll move in a way that's. So I wouldn't be so, unless there's a specific physical problem that needs some attention or physical therapy. But a regular healthy kid should just move, and their body, like the body, is an intelligent, designed machine, and children. Moving is a good thing. The worst thing would be static posture, too much TV, too much internet. Don't even get me started. But that's the danger. That's the risk. Not moving well, I don't see as the bigger danger as not moving at all.
I wanted to add something to that. I think ballroom dancing should be added in the curriculum because it teaches not only good posture and movement, but communication with another person. I'm a tango dancer, and I suggest you get your kids out there dancing.
Okay, so I am just starting my second year of being a chiropractor, and so aside from structural things, obviously I'm also very interested in helping my patients with everything else that you guys have been talking about as far as diet, sleep, exercise, lifestyle habits, decreasing stress. But I find that in the amount of time that I'm able to spend with a single patient, I can't see and discuss all of that. So I guess if any of you can speak to how you do structure your time with your patients to make it efficient, but also able to cover a lot of ground at one time, or any strategies, that would be great.
I guess I have a question for you. How long is your first visit with the patient?
First visit is 45 minutes.
45 minutes.
Yeah, so, I mean, my first visit is an hour and a half. What's yours? 2? Yours? Or
1 hour.
1 hour. Yeah, so, I mean, I think 45 minutes is challenging to get a lot done. You know, I think in that time, you might actually tell them we're going to go through a few things, and then when you come back, we're going to talk about a few other things. I can't do it in under an hour and a half. So I think that would be the first thing. If there's a way to build in more time, that would be great. Because otherwise, then you really do have to triage, which means there would be questions that maybe will be really important. You know, one thing I've learned is that patients usually give the best information right before they leave their first visit, you know, because you haven't developed a rapport and you're asking them to give you their whole life and they don't even know you. So maybe by the end they're starting to feel the warmth and then the big 1 or 2 things really come out, you know, like, oh, okay, I had a patient who was in his 60s, a Wall Street fellow, and him and his wife used to take ecstasy at night, and he told me that right at the end, because he came in for heart trouble. And his cardiologist didn't know that, and he tells me right before, you know, I asked the question about, do you take any drugs, or, you know, because I always ask everyone that question, not expecting that answer, and I wouldn't have gotten that any earlier in the night.
That's some root cause resolution for you. I think you're going to add something there, Kelly.
Yeah, I would just give a plug for what Robin Berzin has saying for a long time, which is that maybe in your practice model, it might be useful to make videos that you expect your patients to watch and have that be a way to communicate some of the essential concepts that you find yourself without time to.
I would add to that. Technology is a great way for that, and I think one of the skills that doctors really is an important skill is curation, curating resources and tools for them. I go and see Dr. Robin Berzin, as she's now my doctor, and she has these health coaches in the team, and so like I'm traveling and I can't do the exercise, what can I do? Oh, she knows about this app that you can download that gives you where you can do anywhere, and you know, it's been really useful to do that, so she's given me that education in the time that I'm not in the office by curating effectively, and that's a big skill, and we're going to be talking about that next week. All right, we have a question here at the front.
Yes, a comment and a question. The comment is about the first visit. You can have a lot of information given to the patient beforehand. You can send questionnaires, and a lot of information they can send you beforehand, before you see the patient, so you have more focus on the visit. But the question is for the dentist, and I wanted to know what's your suggestion about people with bruxism, with grinding teeth?
Well, traditionally dentists will put in mouth guards, and often they're making these very heavy mouth guards, which I think are totally unnecessary. Just a very thin repositioning appliance will open up the airway and help your sleeping, and it doesn't have to be thicker than 1 millimeter, and that'll act as a proprioceptive block. And of course, counseling on stress. And often I think stress could be nutritional besides emotional. You can have other kinds of stress. You could have respiratory stress at night, which causes the bruxism, but it definitely can lead to other issues, dental issues.
My Taoist master always tell their patient, get laid.
I'll try that.
Why do you think he's doing the ballroom dancing? Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you. It's called the 5 Steps to Becoming a Leader in Your Wellness Community, and it'll give you some of the starting points on how to position yourself as the leader in your zip code of your health community. All you have to do is click on the link below.